Well, it is an honor to be here. For those of you who have been supporting Judy's House, thank you. This is really a gem, and I want to put into context some of the discussion that will happen today. Right now, we are seeing a youth mental health crisis like never before. The Surgeon General has called this out, looking at a range of indicators, including emergency room visits, suicide. Young kids are not all right. They are, at base, more lonely, more isolated, don't have the coping skills, don't have the support, don't have the connection. So when a young kid who already at base is not doing all right suffers a loss, it's even more important to be there to support that individual. Because by being there at that critical moment, we can help people rebuild their lives, as opposed to having trauma sort of build on itself. So the work here is crucial for Colorado. It's crucial for our nation. You're not only a gem here in Colorado, you're helping to provide light for the United States on how to deal with this issue. So I am so appreciative of the work you're doing, thrilled for this conversation, looking forward to ways to partner, and thank everyone for joining us.
I am Vicki J., and I am honored to be the CEO for the National Alliance for Children's Grief. I'm very excited to be here. I am proud to be connected to a community that cares this much, that comes together to have a conversation across many, many dimensions.
What has been the impact of the pandemic on childhood bereavement specifically? We are very fortunate that our co-founders, Dr. Brooke Gracie and Brian Gracie, invested in research here at Judy's House and created and established JAG Institute, where we have a dedicated team working to help us better understand the landscape of childhood bereavement and how to best support bereaved children. And one of the things that team has developed is a tool called the Childhood Bereavement Estimation Model. We call it the CBEM for short. And I'm going to tell you a little bit about what we learned when we looked at the first 2 years of the pandemic. So pre-pandemic, on average, 260,000 children were bereaved every year because of the death of a parent. That's 712 children every day pre-pandemic. Fast forward to 2021, which is the most recent year of data that we have available to us. And in the U.S., in 2021, we saw a 46% increase that year compared to those pre-pandemic years. 383,000 children. It was 1,051 every day newly bereaved because of the death of a parent. This is an astronomical increase. So in Colorado, in that same period, when we look at pre-pandemic and compare that to 2021, we saw a 49% increase in the number of children who were newly bereaved in 2021 because of the death of a parent. And I know it seems small in comparison to those national numbers, but that's 17 children every day in our state of Colorado. Part of this is COVID. So in 2021, 12% of the children who experienced the death of a parent experienced a COVID death. In Colorado, that was 8%. These were significant increases compared to the number of COVID losses we saw in 2020. But that is not the whole story. And that's a lot of what brought us to where we are today. When we looked at these increases, we wanted to understand what are the types of losses that these children are experiencing, because we know that how we approach a child who experienced a parent death because of cancer needs to be different than how we approach a child who's experienced a death because of homicide. And so we wanted to look at those numbers and say, where are we seeing the most significant increases? And we saw that a lot of it was in terms of these stigmatized death losses, where we know that we need specialized interventions for these kiddos. So let's take the case of homicide by gunfire. Fortunately, it's a rare occurrence in our country and in our state, but it still happens. 4% of the children who were newly bereaved because of the death of a parent in 2021 experienced a homicide by gunfire. And here in Colorado, it was 2%. When we look at those pre-pandemic to 2021 average comparisons, in the U.S., that 4% was an increase of 48%. So we almost doubled the number of children who were grieving a parent death because of a homicide by gunfire. And in Colorado, it was 57%. So we more than doubled. In the U.S., that means that each day in 2021, 43 children experienced the death of a parent due to homicide by gunfire.
So what are you seeing in Aurora, and what can we do as a collective to, combat that?
Because gun violence is so multi-pronged, right? We have suicide, homicide, we even have mass violence now. There's different things you talk about with your children, with your community to address all of those things. But the biggest thing is talking to them about gun safety when you're talking with children or just a family member, a loved one. Having those open, honest conversations about how do we store firearms properly, talking with them about vigilance when it comes to mass violence, unfortunately. Talking to your children about how do I report something that feels maybe wrong. It feels like maybe I need to get an adult involved. It's just really hard conversations all over the place.
Regarding suicide, we actually saw year over year nationally a decrease in the number of children who were bereaved because of suicide pre-pandemic. Yet, when we come in and we look at those 2021 numbers and we look at the number of children who are newly bereaved because of a parent suicide death, that number nationally was 27,266. So we had seen this decrease, but we rebounded and then some. That was 75 children every day. Here in Colorado, we didn't see that same decline, but we didn't see a noticeable change either. We stayed pretty even in those pre-pandemic years. But when we look at 2021 and we look at the number of children who experienced a parent death in 2021, 1 in every 9 of those children experienced a parent's death due to suicide. And so, again, I think we know here at Judy's House the importance of being able to meet those families in a way that responds to their unique situation that they're walking in the door with. We put families together who have had similar types of death losses. So if you've experienced a suicide loss, you're going to be with other people who have experienced a suicide loss. And what we found is that takes away that stigma, and it makes it possible for you as an 8-year-old to say, my name's Billy, and my dad took his own life. And to hear another kid say that, it might give you the courage to say it in a way that you can start processing that loss. And maybe before you had been so avoidant or so afraid to say that out loud, but that connection means so much.
Lena, you shared that you have a personal connection and a lived experience. And thank you for that. And that probably drives your why this work is so important to you. But can you share a little bit more about why it's so important?
For me, honoring my sister is creating the world she deserved to have lived in. And so working for the Office of Suicide Prevention, working with partners across the state, means that I have support and resources to create a world to address those underlying reasons why people feel suicidal, why people attempt suicide, and why people die by suicide. In suicide prevention, we often say that this work is hard work and it's heart work. We can't do this work without being here, being present, having our hearts be part of this work. So many people on my team have also been impacted by suicide. We're here because we care. I also think it's important that we have leaders in these spaces who have been directly impacted by the causes that we're working on. We want to represent, we understand the nuances, we understand what barriers of access to care look like. And finally, again, just to note that postvention is prevention. We want to support people who've been impacted by suicide because we know that sometimes people who've been impacted by suicide might also feel suicidal, and they might need additional resources, and there's specific care and resources we can provide for people to make sure that those who are bereaved by suicide don't also attempt suicide. There's no one reason people attempt suicide, feel suicidal, or die by suicide. There's no one way to prevent suicide. Different people, different communities have different needs, and we want to make sure that we have approaches and strategies that meet all Coloradans' needs and are appropriate to everyone's situation. It's also important for us to know that when we look at suicide fatalities, for every 1 death by suicide, about 280 people seriously think about dying by suicide and don't. So for someone who's experiencing suicidal despair, the most common outcome for that person is that they will survive that suicidal despair. And so we want to hear their stories, empower their experiences, understand that many of us in any space have experienced our own suicidal despair, and we have survived it. How have we survived it? What could we do differently? How can we support people? So people who feel connected to their peers, to their communities, to their friends, and their workplaces are less likely to feel suicidal. And then finally, postvention, providing people with resources after they've experienced suicidal despair, a suicide attempt, or a suicide loss is really important.
Unfortunately, this is where we see the highest increases and the highest incidence of childhood bereavement following the death of a parent, and the increases that we saw pre-pandemic to 2021, 2020 were staggering. In the U.S. in 2021, every day, 262 children were bereaved because of a parent's death from an overdose. This is a 60% increase compared to that pre-pandemic average. And here in Colorado, it was a 96% increase, an almost 100%. That was 4 children every day in 2021 experienced the death of a parent because of an overdose. And when we break that down and we look at the number of children who are bereaved because of a parent death, in 2021, both nationally and in Colorado, that was 1 in 5 children. There is the possibility for prevention. And at Judy's House, we very much believe what Lena said, that our intervention is prevention.
So Jamie, what can we do to join your efforts in addressing this situation?
We know that grief after substance use passing is one of the most stigmatized loss. Sometimes it can be very hard for family members to talk about, why their loved one passed, or even that they passed or were having trouble. For some folks, they prefer to use poisoning or overdose because it might be the first time that someone ever used a substance and it was contaminated with fentanyl. So there's so many different reasons that comes to the loss. So I think the first thing that we can all do is shed light on this issue and try to take away the stigma. Our office right now has a wonderful opportunity to bring resources and dollars to the state. We know that really this needs to be along all continuums, and one of the most important areas is family support, because we know that for any loss of a parent, that puts you at higher risk for substance use or misuse or other risks. And so therefore, helping children early on is really the best prevention that we can do. And we know that an ounce of prevention is worth pounds later in the outcomes. And so I could say that for one thing is to invest in children is key, who can maybe not speak for themselves.
We know that Judy's House supports families that have endured loss. Can you help us understand what you need to go forward, what we need to resource and equip our families with?
Funding. We need the funds to do this important work, and that funding should go towards 3 primary areas, in my opinion. The first is research. Here at Judy's House, we are so fortunate to have a well-resourced research team. We have the Childhood Bereavement Estimation Model. We have a program called the Childhood Bereavement Changemakers, where members of the National Alliance for Grieving Children and other organizations that serve bereaved children across the country come and work with our evaluation and research team to strengthen their data utilization practices and their program evaluation practices, and to hopefully improve their programming. Second, we need training and education, being able to hire not only mental health clinicians, but mental health clinicians who are interested in learning and understanding bereavement and trauma in children and families. And then we need education for our community. We have a program here at Judy's House where our community-based care team goes into schools and talks with children about what does it mean to be grieving, and how do you recognize if you are grieving and you might need additional support, and how are you a supportive friend to somebody who's grieving. And then finally, we need to fund a continuum of care for families who are bereaved, and we need to take a family systems approach, because grief doesn't happen in individuals, it happens in systems. And so learning how to support bereaved families is only going to improve the way that we support bereaved children.
If I heard one theme, it was that we need to talk, share, and listen to each other. Thank you all, and let's give our panel a great big round of applause.
To access resources and learn more, go to childhoodbereavement.com.